my name is Andrea Green, ADN student at Wilson State College, and today I'm going to be demonstrating the skill of transfusing blood. So first I am at my station and I see I have an order from the healthcare provider for Samantha Lewis. She's a 43-year-old female. Her date of birth is 6/10 of 1975. And I see that he has ordered to transfuse 2 units of PRBC now and then also get an H&H 1 hour after transfusion. So I'm going to want to perform my hand hygiene. And after I've confirmed that they've had these orders, I also just want to check to make sure that they did an H&H and have the compatibility test done. So I see that they did do one and she is B positive, and they did that on the 16th of November 2020. So I can confirm that with the blood and then also with her blood bag as well, or her blood band. So I'm going to perform my hand hygiene and I'm going to enter my patient's room with my blood tubing, my normal saline, some alcohol swabs, and as well a flush to make sure that her line is patent. So I'm going to enter my client's room and I'm going to introduce myself. Hi Samantha, I'm your student nurse today. My name is Andrea. Can I get you to confirm your name and your date of birth for me? Samantha Lewis, 6/10 of 1975. Okay, perfect. So that matches. I know I have the correct patient. And then I'm going to ask her about her allergies. Can you tell me about your allergies, Samantha? Codeine. Okay, and that matches. And we're not going to be administering any codeine today, so we don't have to worry about that. So Samantha, today for you I have, your doctor has prescribed a blood transfusion. Do you know why you'd be getting that? Yes, it is for your anemia. So your hemoglobin is at 7.5. So we're going to want to give you some blood to try and get those levels up. So here I have a blood transfusion information sheet for you. And after she's read that and I've answered any questions that she may have, I can get her to sign her blood transfusion consent form. So after making sure Samantha has no more questions, I can begin preparing my supplies. So I'm going to perform hand hygiene and don my gloves. And I'm just going to assess her IV site, and I see that she has a 20 gauge IV in, which is what we want, an 18 or a 20. So that's good, and it looks to be not infected. It looks to be a good IV site, so I'm going to flush it just to make sure it's patent. And while I'm doing this, I'm going to be explaining to Samantha what I'm doing, that I'm just flushing her IV, making sure that her line is patent for this blood transfusion. Make sure the air is out, and then I can connect this. And I'm going to want to aspirate to make sure I see some blood return. And make sure that this is unclamped. So once I see some blood return, then I can push this through. Now, this trucks is already quite wet, so I'm not going to push this entire flush through because it's going to make a mess. But the idea is I push the entire flush through, watch for infiltration, and make sure that the IV site is still patent. I've already seen that blood return. I just don't want to make more of a mess on these sheets here. So then I can lock her saline lock, and my flush is initially, I know that the vein is patent. So now that I know it's patent, I'm going to hang my NS, but first I'm going to get some baseline vitals for her, just to know her baseline before we do that transfusion, because we're going to want to get vitals through the transfusion as well. So I'm taking her vitals, and her temperature is normal. It's 97.8, which is a good temperature. Every other vital is normal, so we know her baseline, and we can monitor that throughout the transfusion. So I'm going to prepare. I've changed my gloves, done hand hygiene, and I'm going to prepare my normal saline and plan my tubing. Okay, so I have an unopened bag of normal saline here, and then I have some blood tubing. I'm just going to make sure all my roller clamps are closed before I begin. Okay, so all those are closed. Okay, so I have my brand new unopened bag of normal saline and my new IV tubing. And I can spike my bag. Okay, so then once that's spiked, I've made sure all my roller clamps are closed. I can hang this. And I'm going to just double check that they're all closed. And I'm going to prime my line. So I can open this, and I'm going to squeeze my drip chamber to about halfway. Okay, so my drip chamber is about halfway, and then I can open this roller clamp and prime my line. So then if I were to drop my cap like this, I'd make sure I have a blue cap, but because I don't have one, I'm going to pretend like this is a blue cap, so then I can keep this sterile. Just because I did drop it, so I know I need a blue cap to keep this sterile so that I can still use this tubing. So now that that's primed, I'm going to hang this here. And this is ready to go, so when I go and get my blood, because I only have 20 to 30 minutes once I have my blood to hang it. So after I know that Samantha has no more questions for me and that she understands the procedure, I can head to the lab and grab the blood for her. And I've already done her vitals, assessed the IV site, so we're good to go. Have her consent, so I'm going to head to the lab. So I have my slip here for the lab. And I'm going to grab the blood from the lab and we'll do our first check. And I've done hand hygiene. I'm going to put on some gloves. Okay, so I have our blood here. Me and the lab person are going to confirm. We have patient Samantha Lewis, date of birth 6/10/75. Med rec is PCS 78500. Blood band ID is AFN 3889. It is B positive. Dr. Andelin, room 222. And then we have our donor number of 12078. B positive. It is compatible. And we have our cross-match date, which we found on our healthcare providers, was the 16th of November. And then we have B RH positive, so we know that matches. And it expires 11/30 of 2020, and it was taken 11/1 of 2020. And then we have our unit number here that we can match as well, so we know that this is compatible, and I can take my blood back with my gloves, and first I want to make sure that there's no clots and that it looked like a good bag of blood to administer to my patient. And it does. So I can carry this back to my room to my patient with gloves on. And then I can come back into my room, and I'm going to have my second nurse verify after I confirm that I'm in the correct patient's room. So I have Samantha Lewis. And can you confirm your name and date of birth for me? Samantha Lewis, 6/10/75. Perfect. And again, her allergy is codeine, but we aren't giving any codeine today. So me and my nurse are going to confirm that we have the correct information. So we have Samantha Lewis. Donor ID is 12078. Date of birth for Samantha is 6/10/75. Med rec is PCS 78500. Blood band ID is AFN 3889 and AFN 3889. So we know that matches with her blood band. And then it's B positive. B positive. Blood bag is B positive. Dr. Andelin, room 222. Donor is B positive. It is compatible. It was taken on this, or the cross-match was taken on the 16th of November 2020. And then our expiration date is 11/30 of 2020, and it was collected on 11/1 of 2020. So can my nurse confirm that that is correct?
That is correct.
Okay, so now that I have that confirmed, I can change my gloves, perform hand hygiene. I'm going to do one more check for myself, just to know that I'm administering the correct blood to this patient. So I have Samantha Lewis, date of birth 6/10/75. PCS 78500. Blood band ID, AFN 3889. AFN 3889. Donor ID is 12078. It is B positive. B positive. Donor is B positive. B positive. Physician is Andelin, room 222. It's cross-matched on the 16th of November 2020. It was collected on the 1st of November 2020 and expires the 30th of November 2020, and it is compatible. So now that I've done my 3 checks, I know that this is safe to administer to my patient. So, I can start priming my line. I'm going to change my gloves, perform hand hygiene, and I can begin hanging my blood bag. And then as well, I want to inform my patient of signs and symptoms to watch for during the transfusion. such as back pain, fever, chills, shortness of breath, itching, any other type of allergic reaction or transfusion reaction within the first 15 minutes or throughout the reaction or the transfusion as well. So I'm going to make sure that all of my clamps are closed. So they're all closed. I can spike my bag. And I made sure this is a good bag of blood to hang for my patient. And I've done my 3 checks. So I'd answer any additional questions from my patient, any concerns or anything, and given her all the appropriate information for throughout the transfusion. So I can open this clamp after ensuring one more time that all my clamps are closed. Open this one, and I'm going to fill my drip chamber. Okay. And then we're just going to prime our tubing very slowly so we don't lose any blood. But then this way, the blood will get to the patient quicker once we connect it. It is already primed with NS, but then the blood is through. Once the blood is through the tubing, we're going to clamp all of this. And we are going to clean Samantha's port here. And again, just confirming I have the correct patient, the correct blood ID band, and her allergy, which is codeine. We don't have to worry about codeine today with blood. So I'm explaining to Samantha that I'm just going to connect her blood here. And if she has any additional questions, that I can answer them. I can connect her IV tubing and then unlock the saline lock, and I can set the drip rate here. So we're going to set it fairly slowly to begin. We want about 15 to 20 drops for the first 15 minutes to monitor Samantha's reaction. So we set it about there. So we're going to stay with Samantha for about 15 minutes while this is going, just to monitor for a transfusion reaction such as that back pain, fever, chills, shortness of breath, any other allergic reaction signs or transfusion reaction signs while this is going. And then after 15 minutes is up, we're going to want to take another set of vitals, make sure the temperature is still good and all the other vitals are normal, which they are. So then after that 15 minutes, we can up this transfusion to the prescribed dose, which we're going to up it to 175 milliliters per hour. And then we can leave the room once we know that our patient is stable and that they're tolerating the transfusion well. So we're going to want to come back every 15 to 30 minutes to check on Samantha, just to make sure that she's still handling that transfusion well and doing vitals every so often, just to make sure that our patient is stable. And then once this transfusion is finished and she's tolerated the transfusion throughout the entire 4 hours, we have maximum 4 hours to give this blood. Once she is all finished, we can close all of our tubing. And we can disconnect her. I just want to mention that although the red didn't make it all the way to the patient, it's because I put it very, very slowly so that it didn't make a mess all over the bed, just for simulation purposes. But we'd want to make sure the blood's all the way down to the client. As well, now we're going to open the normal saline on both roller clamps, and we're going to flush her line with the normal saline before we discard so that her line is flushed. So once that is flushed, we can close all this, and we're going to want to get another set of vitals to make sure that she's still stable and she's doing well. Ask her how she's feeling, if she's having any symptoms. And then we are going to disconnect her from her tubing. Okay, and then once she's disconnected, we are going to throw all of this into a biohazard bag, as it is a blood product. So this would all go into a biohazard bag to be thrown away. And then we're going to want to just stay with our patient, make sure that she's doing okay, if she needs anything, if she tolerated okay any symptoms. And then once we know she's stable, we can leave the room and we can go and document. We need to document the time we started the transfusion, her vitals throughout the transfusion process, the time in which it took to administer the transfusion, so how many hours, the time we went and got the bag from the lab, as well as our 3 checks, and then the time we discontinued the infusion, how the patient tolerated it, any signs and symptoms that occurred, and that transfusion was complete. And then that would be the end of our skill.